kind of think of it as like dirt at the bottom of like a pool. We want it all to stay down there until we're ready to pull it out. So we don't want to shake it up and suspend it. So we're going to take one of your 10 cc syringes, and then you're going to hook it up to the extremely large, it's a 16 gauge, like 65 millimeter needle. This is just an extraction needle. So the other good thing is to sometimes do this not in front of the patient because they see this needle and we get nervous. But we don't use this for injections. This is just to extract it. Go in there. I'll just let that sit right there. This needle right here is a vent needle. I will let you guys know it does sometimes come in different colors. So if you just see it separate, just kind of take a look at it. It's just another large needle that's filtered. What this does is this just allows the pressure out of here, so it's easier to pull the PRP out. Other than that, it'll just keep suctioning it back in on you. So we just put this in barely at the top, and that just lets the air pressure out of there. Once we have that, we're gonna go ahead and pull out, if you can, as much as possible from the top and work your way down. And we're just gonna remove that top 6 cc's or so. We'll do right there. Get that flag. Should we close out for this part? So after you remove the platelet poor plasma, you'll take out your other 10 cc syringe, and we'll hook that up to this. Now we want to suspend those platelets. So they sit at the bottom. So how do we do that? We just gently tip this back and forth, and we're gonna do this nice and soft about 10 times or so. Do not shake it like hard or rigorous. This gel can separate and those red blood cells will go in there. You will most likely start to see maybe some clots floating around in there, and you will start to see this fluid maybe thicken up and darken up. That's a good thing. That's just because it's got those additional platelets and growth factors in there. So it usually looks a little bit darker than the platelet poor plasma.
So about 10 times.
Mm-hmm. After we do that, you just have to tilt it like on its side, and now we're going to pull the rest of it out, and this is the stuff that we're going to inject.
That's the good stuff.
There we go. And so now you should have right around 6 to 8 cc's of your platelet-rich plasma. Platelet poor plasma, platelet-rich plasma. You can see right a little bit cloudier. This one's a little bit more transparent. This one's a little cloudier, so this is the better stuff. This right here, I would say for the staff, try to do this not in front of the patient. They think this is like, there's a lot of benefit to this, and if you throw it away in front of them, they think you're just throwing away money. That's not the case. This is plasma. It's like yellow water. This is the PRP. This is the stuff that's beneficial. It's in the 10 cc syringe over to a 3 cc syringe. It makes it easier to inject into that subdermal space. You just hook up your female luer lock into there, and then just push it in. You're going to be using a 27 gauge half-inch or a 30 gauge half-inch for the injections. All right, so right now what we're using is the Eclipse 11 ml PRP2, just spun down, red blood cells, separating gel, and our PRP up here. So a few times we're going to go ahead and suspend those platelets, and then go ahead and extract them into our syringes. This is like nice and easy. So you just take it like this, and then
Okay.
just have to pull it out like that. one.
Try.
Just get a good pull. There you go. Keep pulling. It'll pull against you. Just pull it all the way down.
Okay.
Perfect. All right, that's it. Got a little bit left in there.
Good. Just a
So the 11th is much easier.